And good evening, everyone, and welcome back to another episode of Mind Split Cafe. Today is a special episode as we have Dr. Alcides Amador with us, who is a longtime friend and actually graduated high school with him. So it's awesome to have him on the show. And of course, we have Matt as always with us.
What's going on, guys? Doc, welcome to the show.
Thanks for having me.
Absolutely. You want to give us a quick introduction and an overview of yourself and what we're going to be discussing today?
Sure, yeah. Thanks for having me on the show. My name is Dr. Alcides Amador, and I'm an assistant professor of psychiatry at UTRGV School of Medicine. My specialty is in child and adolescent psychiatry. So I see patients at the UTRGV School of Medicine, and I also teach our residents and our medical students during their psychiatry rotations as the psychiatry clerkship director.
Wow.
And
You got a full plate.
Basically, ladies and gentlemen, the summary of everything he just said is the man. Dr. Amador is the man. So that summarizes it right there.
Thank you. And today I'd like to talk to you all about the work we're doing in one of our UT clinics called our Texas Child Access Through Telemedicine clinics, or our TCHAT clinics, where we provide telemedicine services, specifically mental health to kids at their school districts. And I'd also like to talk about depression and anxiety.
It's awesome. Sounds like it's going to be an interesting episode. What do you think, Matt?
Yeah, I think it's good. It doesn't sound depressing at all. Boom. I'm just kidding.
All right, Doc, you want to just kind of give us a brief overview of what the UTRGV Health is, and then we can kind of fall into the topics that you want to discuss?
Sure, yeah. So UTRGV Health Art Clinics, we see adult patients, children, and adolescents in our clinics in person. So we have a group of, psychiatrists. We also have, psychologists also that help us see our patients in our clinic. Um, and then we also have a different clinic that comes under this. It's called our TCHAT clinic. And like I'd mentioned before, this is a telemedicine slash telepsychiatry slash mental health service that we provide. So we could see kids and teenagers with, in their schools. So they don't have to be pulled out by their parents, right, to go to the doctor's office. So it makes it more convenient for them to be seen. And this program, the TCHAT program, is a statewide initiative. So it's being funded by the state of Texas. So most of all the medical schools around Texas are taking part of this program. And UTRGV, we've been given charge of the 13 counties of South Texas. So if you kind of draw a line from Laredo to Corpus Christi, we're servicing all the school districts who, are interested in the program.
Wow.
That's phenomenal.
That's do you know how many school districts that is? I mean, 13 counties.
So right now we're in over 400 campuses. So that's going to be a little bit over 30 school districts.
Wow. And your program not oversees, but kind of not manages, but yeah, I guess oversees the care for those 30 school districts in your field, correct?
Yeah, for us, yeah. So it's going to be a little bit over 200,000 students have access to this program, right? Not all of them, right? Might want to access it, right? But just based on the numbers, about over 200,000 students have access to this program.
Wow.
And that was actually good.
Oh, and it's completely free to them, correct? Like if they want to seek out the treatment?
Yes, it's completely free.
Wow.
So I had a question, and you kind of answered it partly before I could ask it, but you said there's around 200,000 students that have access to it. How many of them do you think actually participate in it or have participated in it up to this point?
Up to this point, I would say in our region, I would say since our program has started, I'd say probably a little bit over 1,000 or so. To give you an example, in October, we had over 500 referrals into the program. our program was launched in about 2020. And of course, right, there was a little bit of, the program wasn't able to fully roll out as we had planned because the pandemic, right,
Oh
upended
yeah,
a
of
lot of
course.
things. But I would say a little bit over 1,000 students.
Hmm.
That's awesome.
Now
I'm sure it'll
I'd
grow
like to
too.
ask you this question, right? So 200,000 students, you've seen 1,000 or help treat or continue to treat. Um, are you guys, psychiatry, are you guys tasked to like um possibly, with Uvalde and that tragedy over there, just north, I guess, of that line, right? Laredo to Corpus. But are you guys tasked to kind of possibly identify someone that's really, really depressed that might be, on the verge of taking that next, step of doing something, I
Unimaginable.
don't even know what the word is, but just doing something that's that insane and hurting that many people at a school district.
No, yeah, for the program, right, what we do is we try to identify, the program tries to identify the kids, adolescents who are at risk, right? If
Mm-hmm.
they're, if the depression, like you had mentioned, got very severe, anxiety, or something, something more severe going on, that's what we're designed for, to evaluate and assess for all these types of possibilities.
Wow.
So,
Golly.
what's the importance of increasing access to behavioral health? I mean, this program is obviously a much needed thing. What's the importance of this, and how does it help our communities?
No, yeah, so great question. And, per the statistics from the CDC, from about 2016 to 2019, a little bit over 4% of children and teens were diagnosed with depression, right? So if we applied that right to our population in Texas, right, that's going to be quite a chunk of our kids and our teenagers. So this program's really helpful because we can identify early, right? Hey, the child is struggling with depression or anxiety, and we can intervene right before their worst type of outcomes. Another example I could give you, right, is that suicide, right, is the second leading cause of death in young people about 15 to their early 20s. And if we want to apply it to kind of our South Texas, Rio Grande Valley area of the country, a big portion of our population falls under that, about around 30% or so. So it's really important to catch these things pretty early to decrease those numbers.
Mm,
Yeah, no kidding.
God.
So, I wanted to. So, does this all take place telemedicine? I know you said that it is telemedicine, but do you guys have a clinic where the students can come in if need be, or if you deem that it's necessary, or how does that work?
Oh, yeah. So the way the state designed the program is that all the services, right, take place at the school district. So the school districts who have partnered with us, we've identified a space, whether it's the counselor's office or another room at their school, where they can have that access to the telehealth equipment that we provide. So it could be an iPad on wheels or a computer on wheels, and we'll do our evaluations and follow-ups there. But if there are cases where the student, you say, hey, you know what? It's great that we started via telemedicine, but this patient and their family, they would benefit from more in-person services.
Mm-hmm.
We can make those referrals in place so they could come see us at our regular UT Health RGV clinic. Or if they have a clinician that they would rather see that might be, closer to their home, or if they want to go see somebody at the local mental health authority, we have those connections in place to get them those referrals.
That's great. So, even if you can't help them, or they want to go somewhere else, you still help them get there with a referral or what they need to go see another clinician.
Yep. So for our program, right, if we feel right that they need a higher level of care than we can provide via our telemedicine service, then we help them hook them up with all those services that they need.
Now I'm still, 200,000 kids that you kind of oversee. Um, or available for the treatment if they seek it out, but and you've got 1,000. What is the capacity that the number of kids you could treat? Could you treat all 2,000 if they just flooded the gates, or like what? How many patients can your department handle via the way this program is rolled out?
Oh, okay. So for our typical work week for our clinicians, right, it's going to be about, 40 hours or so, right? If we count it through the Monday through Friday type of thing. So let me see. Those numbers would be so about 40 clinical hours per week. So I would tell you that probably our clinicians, if we were they could see about 10 people a day. So it'd probably be about per clinician about 50 a week, 50 patients or so a week.
Wow. Okay. But it just rolled out, and it rolled out during a pandemic, right?
Yeah.
So, I mean, how do you guys market? I have a marketing background, right? Shout out to UTRGV because I graduated from Pan Am, but um how do you guys quote unquote market within the schools with the counselors to say, hey, like we've got this program, start identifying, adolescents that you feel may need, that would benefit from this program? How do you guys do that? And
Oh, yeah. So our outreach, we do several different things. We send out emails to the counselors, superintendents, letting them know about this program. We
Mhm.
also do visits with the school districts in
Fantastic.
person. An example I can give you is that last month we met up with the Sherryland Independent School District. We hosted it like a booth. We hosted a training to teach them about the program. We have them on board as one of our latest schools to take advantage of the program. So, we do communications via emails, and then we also visit the schools in person to tell them about the program.
How excited were you? You and Chris are both alma maters from Sherryland. So how
Yeah.
excited were you to kind of go back to your old stomping ground and, kind of
It,
help roll this program out?
it was great. No, it was great getting the program there, seeing some of the staff members, counselors, from when we were in high school there,
Uh-huh.
very excited about the program too. So it was great.
I'm sure they're very proud of you, Doc. I'm sure they're very proud of you. So
Oh yeah, Doc Heat, man, you're one of the ones that excelled after. I mean, we all excelled, but I mean, you're a board certified doc in CNA. I mean, that's phenomenal.
come
I know
on,
Sherry.
Chris. You got Mind Split Cafe podcast. So you've done well for yourself too. Come on.
Yeah.
Thank you, Matt.
Yeah.
So I know we're kind of always we're bouncing around with the questions, and I wanted to dig a little deeper into some of the things you see with patients. You're talking about anxiety and depression. What leads children to get to that point? I know adults, they have all kinds of things going on in their life, but what is it that leads a child to being depressed, clinically depressed, or even,
Primarily, yeah,
yeah,
one of the causes.
No, a lot of the things that we see right in our clinics that have led to kids to develop depression are when families aren't together, right? When mom and dad has split up, um, the kids don't always necessarily have the understanding of what type of coping skills they may need to have, right, in order to deal with that, right? Because in a young person, right, ideally they always want to see their parents together, live with their mom and dad, but sometimes, right, it just doesn't work out that way.
Hmm.
Um, and so sometimes, right, we have to go in and say, hey, you know what? Although, right, this isn't working out between the mom and the dad, still got to foster in the child, like, hey, this doesn't mean that mom or dad doesn't love you, right? This is just something that hasn't worked out. And just explain to them in a developmentally appropriate way, of like, hey, this is happening, but we still care for you. Because sometimes the children and the teens feel like, oh, it was my fault that my parents aren't together, or I could have done something differently. So
Hmm.
we just got to reiterate to them that it's not their fault.
Mm.
Other
what
things
is,
that was
go ahead.
I was gonna say other things that we see that have contributed to depression is, the increasing use of social media
I was
in
gonna
young people.
I was gonna ask you about that, especially like doom scrolling. That's kind of the new, where you're just scrolling and it's just getting worse and worse because they're seeing all of other people living these lifestyles that maybe they, admire or wish, that they could live. So talk a little bit about social media and how it's affecting the youth in for depression and anxiety.
No, yeah. For what happens is that, right, the kids may be scrolling and they see very idealized, very, picture perfect posts of people doing things when it might not be 100% accurate, right? About like,
Mm-hmm.
oh yeah, I'm living my best life, right? So the kids might feel bad, it's like, oh well, I'm not able to do that. I don't have these many followers. I don't have this. So they start feeling bad about themselves that they can't achieve that level of happiness or success that somebody's portraying that they have on, on one of the social media platforms. And we know, right, that these social media programs, they hire, right, neuroscientists, behavioralists to say, hey, how can we get kids and, adults to keep on clicking, right? So
Mm-hmm.
they have their ways of trying to make sure that you're on it.
That's interesting.
Wow.
That is absolutely interesting.
So they have doctors, they have colleagues of yours pretty much, right? Working for the other side. Am I correct when I say that statement? You have colleagues that are working for these social media platforms that are trying to get their users and analyze their users to engage more, correct?
Yep, they consult with, experts and behaviorists and things like that. Kind of
Wow.
like in kind of like in marketing types of things. Like what types of things would get people interested in our products, right?
Mm-hmm. Wow.
That's interesting. I had no idea. I mean, I knew they played off people's mannerisms and behaviors, but I didn't know they went that deep and hired clinicians or experts on it. That's interesting.
So yeah, competing, right? Competing priorities, right, for people, right? The companies want to be successful, and ways to be successful is that they have to understand human behavior and what can get somebody to, you know, be more likely to click and stay on their platform.
Now, this might sound like a dumb question, right? But that's kind of why I'm here. I asked the kind of the everyday man questions, right? But as you, as a clinician that is doing God's work and trying to help these kids in these 200, what, 200,000 kids, 30 school districts, and that's just your area, but somebody that's doing this, and then of clinicians or colleagues that are on the other side, right, trying to get them to engage, and you're basically they're helping get these kids to what you're trying to help, right, or prevent. Do you are those colleagues, are they vilified within the community of other doctors, or is it just like, hey, go, they're getting paid to consult, so let them get their money? I'm curious to see if there's some sort of animosity amongst the community of those clinicians that are kind of helping the dark side, so to speak.
Yeah, what I would tell you is that nothing that I've run into like at meetings or on the internet where things are kind of explicitly said, but people would be like, that's very questionable that
Yeah.
you're doing those types of things.
Yeah.
But not very, I would tell you that's not very like vocal out there.
So there's not going to be a fight at a convention, right? There's not.
No, no.
That's funny.
A
Um,
dance off, like something you'd see in a Michael Jackson video, everybody just dancing off in the ballroom, so.
Dr. Off. So, what
But
is a typical? Oh, go ahead.
but I was gonna say, and that's why it's important for parents, right, to monitor, right, our kids' social media use, just to make sure, hey, is their social media use getting out of hand? We need to set, certain boundaries of this, right? Um, because like with anything, right, parents need to be aware of what their kids are doing, and especially when you're giving them access to the whole totality of the internet, right? There's good and there's bad, but the parents have to be very mindful, right, about what their kids are posting, what they're watching.
Mm.
Yeah, absolutely. And that was I was gonna kind of segue into that. What can parents do to alleviate this, or to at least keep them from going down that dark hole and becoming sad, depressed, and anxious?
Now, some of the things, right, parents, I would recommend for them to do, right, set those, time boundaries, like, hey, you can only use social media for, X amount of time a day or a week. The things that are appropriate to post and not appropriate to post. Other things, right, that are going to be helpful is to families to reiterate to their kids, hey, not necessarily everything we see posted on social media is based, on the truth of what is really
Mm-hmm.
going on.
A lot of it's glamorized and not all true. People always post what they want to show and not what's really going on, or at least that's what I feel.
Yep.
I mean, I feel that it happens that social media or that doom scrolling. I think it, I know Doc is his specializing in adolescence, but I think it affects, you know, adults as well,
Oh yeah,
because I'm 45 years old, and I can still feel the effects of, the whole like, oh well, I'm not there or I'm not this, and it leads me down the rabbit hole of negative feelings and self-doubt, right? And so oh it's just I don't know, it's social media can be great, but you, like Doc said, you definitely have to understand it.
double-edged sword.
Mm-hmm.
So now on the other side of the table to that, what do yourself or clinicians like you do to help treat the patient, the child, when they get to that point?
Oh, got
What's
it.
your
So,
or treatment plan?
no, yeah, definitely. If we're dealing with things like depression and anxiety, right, gonna reiterate to the patients and the families, like, hey, you know what? Different types of psychotherapies can be very helpful. One of the most popular ones is cognitive behavioral therapy, that can be used. It's a really great one for kids, adolescents, and adults. A lot of good data out there that can be very helpful. That being said, right, it is going to take dedication from the patient's part and the family's part to make sure that the patient's keeping track of their assignments that they'll be given in the cognitive behavioral therapy, actively using the skills that the therapist is teaching them, the clinician working with them. So those are one of the best treatments out there. Now, for cases where, somebody, has more of a moderate to a severe type of depression, then we have that conversation about, hey, what do we think about medication? Is this something we should consider?
Mm-hmm.
So it seems like talk therapy is the first route, and medication will be the last resort.
Yep. Mhm. And what I like to explain to the families and our patients is that imagine, right, let's say I'm a person and I have, high blood pressure, lots of cholesterol. My doctor can give me all the medicines in the world, but they're probably also going to recommend, hey, you got to also do some
Change your diet.
exercise,
Yeah.
change your diet. So you can think of the psychotherapy, the cognitive behavioral therapy as the exercise of your mind, just to make sure that you're doing everything possible, exercising your mind, using coping skills. And then we can see if you could be off, your medication, sooner rather than later.
Mm-hmm.
So very similar.
I love that analogy.
Yeah, that was a great analogy, actually.
Yeah.
It kind of seems like CBT or cognitive behavioral therapy. And Matt, you could probably remember that most of our episodes, I do ask like, what's your favorite modality for a certain treatment? And it seems like CBT is like the gold standard.
Yeah.
No, definitely. It is, especially for child and adolescent psychiatry, is it's one of the go-tos.
That's awesome. I am definitely finding this out now. It seems like a lot of clinicians lean towards that. Now, I want to touch right back again. I know we're probably running out of time.
Yeah.
But I wanted to ask about the setup. I know you guys have it set up as telemedicine. Why is that? Why did you guys lean towards telemedicine, other than trying to reach as many people as once? But I'm sure there's some more stuff to it than just the being able to reach so many people at once.
Yeah, so one of the reasons that it was done for, telemedicine reasons, besides trying to reach as many people at once, was that the thought is that in our program, let's say we have a long wait list for the UTRGV TChat team, and
Mm-hmm.
maybe somebody else, like let's say in Houston, Dallas, Fort Worth, one of the medical schools out there, they say, hey, you know what? We have an opening right now. It
Mm-hmm.
could be possible for that student, right? Instead of waiting for weeks and weeks at a time, on the wait list, if there's an opening somewhere else, around the state, they could be plugged in there.
Yeah. And
Smart.
do the youth or do the adolescents have the same therapist every time?
Oh
Or
yeah,
okay, so
yeah.
the therapist follows that child, right?
Yeah, that's a good question. Yeah. So what we do is that our process is that once a child is referred into the program, they come to the intake and assessment where the team, we get the background information on what's going on. And that clinician who does the, intake and the assessment, they will follow that child, right, throughout the program,
Mm,
right? So there might be cases where, let's say, the first clinician that sees them at the intake and the assessment, right? Let's say it's somebody from our psychology team. They're like, hey,
mm-hmm.
you know what? I need to see this patient for psychotherapy, but I also think that we're going to need one of our psychiatrists' opinion that is medication. Would it be helpful to them? They will do that internal referral for us to see that patient also, to put them on our
Mm-hmm.
schedule to see them. So they're receiving both treatments psychiatrically and through psychotherapy too.
Wow.
So the continuity of care is a complete circle at that point.
Yep.
I love
I
it.
love
That's
that.
awesome.
I love that. Well, Doc, thank you so much for joining the show this week. What you've given us, the little nuggets of knowledge, have been mind blowing, and I wish you all the best. I hope you can reach every single one of those 200,000 students, because I think what you're doing changes lives. So I wish you all the best. And again, thank you for joining the show.
Thank you so much for having me and giving me the opportunity to get the word out there about the program.
Oh yeah. Yeah.
Absolutely, and we'll put some resources on our website, and throughout the episode, I'm sure we'll put some resources up for UTRGV Health and the program that you have going on.
Is there a way that they can get in touch with your office via website or phone number that you'd like to share right now?
Yes, and if you'd like, I can actually share my screen. So if so, yeah. So let me get to. Oh, it says that I'm not able to share the screen,
Yeah.
so I'll just read out the number to you. So, our office number is 956-296-7841,
Okay.
and our email for our TChat program is going to be TChat, which is TCHATT @utrgv.edu.
Awesome. You heard it here first. Tchat at utrgv.edu. And we'll make sure the phone number gets posted on the description below. So, Dr. Amador, thank you so much again for joining the show. Chris, got any last words?
Yeah, again, thank you so much for joining the show. Thank you for taking the time. I find it awesome that I went to high school with you. I grew up with you, and you're doing such good things in the mental health space, and I couldn't be more proud and happy for you. So keep it up.
Thank you so much. It's great
Take
being
care.
here.
Yeah, take
Yeah,
care, Doc. V's up.
have a good night, everyone.
Like we weren't supposed to come up with something this clean. Like something happened